I'm here with two of my lovely patients, Val and Winnie, and they have both trusted me enough to do their facelift surgery. And Val, you are 1 month now.
1 month out.
Right. And Winnie, you are
almost 3 months.
3 months out. First of all, how are you doing 1 month out from your surgery?
Well, I'm 72 this week, and I look 45, so I'm totally happy. My neck is gone, which used to go from here to here, but now is a right angle. Jowls are gone. He's a genius. Okay.
You're so sweet. And Winnie, you're 3 months out. How are you doing?
All good. I mean, I can still feel the tightness,
Sure.
but it's, I mean, the beginning was very tight. Now it's softening, and this is all softening now. I can get earrings in again. So it's all good.
So let's talk about recovery. What surprised you? What didn't surprise you?
First of all, I didn't need the oxycodone or anything like that. I just did the Tylenol. It's not that bad. You know, you get a little, a little pain where the things you take a couple Tylenol. It's, it's not terrible. Mostly, I feel so much more confident. You get all dressed up, then you got this crepey neck, and you just feel like you can't look your best. And even though
it's not just that, you don't look the way you feel.
right,
I mean, we're very active. We run around a lot. We do a lot of stuff. We're trim. We're sporty. But then the face was like, what is that on the face?
exactly.
So we just didn't feel. I look in the mirror and I didn't feel like how I internally felt.
Sure. Yeah.
Looking at myself.
Yeah. So would you do it again?
Definitely.
Are there any pieces of advice or pearls that you would give people watching this that are maybe interested in facial surgery?
Don't plan to do anything for the first 2 weeks. Like, don't think you're going back to work or anything. It ain't happening. And also, have something in your car to cover your face up when you go to the hotel, because you don't want people to have to look at what you look like when you come out of surgery, which is shockingly horrible.
And with the drainage things.
Yeah, with the drainage things. My sister was eating the same day. She wanted a salmon dinner the same day. Not me. I was a little nauseous, so I didn't eat anything. But I have more seasick problems.
Yeah.
So my reaction to anesthesia was a little more nauseousness. But we gave us a Zopran, which totally helped. I didn't vomit.
Yeah. Well, everyone's a little bit different in terms of healing and how they
Yeah.
react to anesthesia, so it's very common amongst sisters to have some differences.
All we do now is we part on the side, walk toward each other, and guess how old we are. We say 45 or 40 maybe.
I think as well, the beginning part, you see changes every day.
Yeah.
As the healing happens, and that's really exciting. Every morning I would get up and go look and see, what's better than it was yesterday. And then that healing process slows down, but the healing process goes on for months.
Yeah.
But it's slower. Like you don't physically see it because I look fine, but there's still some healing going on inside. So you have to be prepared for that and expect that that's normal.
Yeah.
Also, your neck is really tight. At first, you can only turn your head this much, so don't even think about driving because you can't look over your shoulder. Now, what am I, in a month, I can look over my shoulder enough to drive, but don't think about driving the first week or two.
Yeah. A month is actually when we release you to do everything that you want.
Right.
So you are free to do
Free to
anything
do
you want at
whatever
this
I
point.
want.
Yeah.
Exactly.
Yeah. And you guys are going on a cruise in a week.
We're going on a cruise,
That's
and we're
right.
going to be dancing on the cruise, and we're going to look good.
That's right. That's right.